So I'm delighted to present to you a collaborative piece of work across the United Kingdom, where the collaboration are very interested in physical activity in people with rare neurological conditions. And in this piece of work, we're looking at the barriers and facilitators to engagement from their perspectives. So we know we should all be engaging in healthy lifestyles, and we're using the WHO definition of physical activity as any bodily movement that's produced by the muscles that requires us to expend energy. So that's an ideal for all of us. However, we know that when people have a disability, only 25% of them actually reach the recommended amounts of physical activity. We know from studies in neurological conditions that there can be intrapersonal factors to do with the person themselves and their symptoms, interpersonal factors, how they engage with services, other professionals and their family, and some environmental barriers around access, etc. We know in some small single rare disease studies that there are additional problems with lack of knowledge of the conditions. So we're very interested to see, well, if we look across rare diseases, do we see similar factors coming through when it comes to people's engagement in neurological diseases? So we decided to look at this with a couple of methods. We started off with an expert panel of clinicians and academics who have experience of managing people with rare neurological conditions. That group put together the topic guides for semi-structured interviews with representatives of some of the rare disease patient support groups, and 7 interviews took place. Those interviews were analysed using thematic analysis, and those themes were then presented to a stakeholder workshop, which included people from the rare disease support groups, but also people living with rare diseases themselves. From that workshop, we developed 3 questionnaires. So there was a survey for people living with the conditions, their carers, and then healthcare professionals who were involved in the care and management of people with these rare diseases. And there was a mixture of questions. So we performed quantitative analysis of the closed questions, descriptive statistics, and a thematic analysis of the free text. So for the survey of people living with the diseases, there were almost a 50-50 split of female to male, and the mean age was 57.2 years, and 96% white ethnicity, which is actually not representative of the UK demographic, which would be about 87%. There's a mixture of diagnosis, with the majority of people living with some sort of neuromuscular disease, 27% with ataxia, 14% with hereditary spastic paraparesis, and then smaller numbers of some of these other conditions. Interestingly, 76 participated regularly in physical activity, and 39% of them needed support in order to do so. When we looked at the carer surveys, 83% of them were female, and the mean age was 52%, and again, a high percentage of white ethnicity. In terms of the relationship to the person living with a rare neurological condition, 44% with either a spouse or a partner, 31% a parent, and 23% another family member, with only a very small number of paid carers. And in this survey, we found that 53% of people with the rare condition actually participated regularly, and 77% of them needed support. So people did tell us about the benefits that they encountered, and they went into the following themes: so they're either physical, psychological, or social benefits. So what people told us, that engaging in physical activity makes them feel more positive and still part of life, and getting out in the fresh air is very uplifting. Others reported that the exercises helped to keep them mobile, keep them on their feet, and without them they might need to use a wheelchair, and also helping with lung function, so some of the physical aspects. The carer here has actually said that engaging in physical activity has kept their family member mobile for longer to retain their strength, keep other bodily functions going, and also keeps them positive. And then another carer here says it's important to remain active because they could see a direct correlation between the amount of exercise their loved one undertook and the degree of their symptoms of their condition. And it also helped the mental health. But there are also negative experiences, again, physical, psychological, and social. So with the physical symptoms, people described issues with fatigue and pain and risk of falls. So here, this person said that they ran out of energy so quickly. And this other person had a different observation, that they felt as their condition was progressive, as they continued to engage, they started to realize things that they couldn't do now that they used to be able to do. And some people, again, with progressive conditions felt that they didn't really make much progress. And it sort of highlighted some of the progressing issues of weakness. And with this person who's a carer, felt that they didn't feel comfortable taking their loved one into a gym environment. And that was an awkward and difficult situation. With the healthcare professional survey, most of the people that responded actually worked in community services or specialist services. The professions were overwhelmingly physiotherapists, but there were also some respondents who were occupational therapists, nurses, and then a smaller number of speech therapists, doctors, and support workers. And they overwhelmingly agreed that physical activity is important for people with rare neurological diseases, and they did frequently give advice, 78% as part of their practice. They felt that they had the expertise to actually give this support, but insufficient resources. And some of the comments that came were that there's a need for specialist knowledge in community centres, gyms, and other therapy services, and that there are some interpersonal issues relating to motivation, particularly if there's depression or anxiety. And they observed that some patients think that there's not much point to staying active. And when we looked at the themes and we put together a framework of the themes of the factors affecting engagement, there were environmental and organisational factors, and the peach boxes show some of the ones that are more appropriate for rare diseases. The white boxes are ones that are common across neurological diseases. So here we see that there's issues to do with access to specialist services, communication, and poor understanding. And from an intrapersonal perspective, there's a poor understanding of the rare conditions and risk versus benefits from healthcare professionals and fitness professionals. And the people themselves sometimes lack knowledge of the risk, knowing what to do, when and how. So in conclusion, we think we had a response bias skewed towards people who engage in physical activity. There were some benefits, but also some negative experiences. But there were some common themes from all three participant groups. And some of those themes that were specific to rare diseases were around access and communication with specialist services and the knowledge of rare diseases of the person with a condition and professionals. So finally, just like to thank the people who were involved in the development of this work and the charities. Thank you very much.